Hello guys, today we are going to be talking about HIV/AIDS, including signs and symptoms, mode of transmission, and the preventive measures. I know there's a lot of you that don't know the signs and symptoms of HIV. So that means you can go and have a contact with a person that is having HIV/AIDS without knowing, and later you can get the infections. So knowing the signs and symptoms of HIV/AIDS, it can help you to prevent yourself from getting the infections. And I know there's a lot of you guys that are thinking that you can get a HIV through kissing of an infected person. So this is not true. In this particular video, I'm going to explain everything vividly from A to Z. So if it's the first time to watch our video, I would like you to subscribe to this YouTube channel and turn on notification bell so that you will be notified whenever we drop something new on this particular YouTube channel. So now without any further ado, let's get into details. Hello friends, welcome to International Medical TV. Like I said in the beginning of this particular video, today we're going to be talking about HIV/AIDS, including causes, signs and symptoms, and the mode of transmission. So let's share a bit of light about the difference between HIV and the AIDS. HIV, this is an acronym of the human immunodeficiency virus. This is a kind of virus that attacks the immune system in your body, such as CD4, B cells, and T cells. You know, these are kind of the white blood cells that are circulating in your body, which help your body to identify the infections, diseases, and disorder in your body. While the AIDS, it is an acronym of the acute immunodeficiency syndrome. You know, like this is the advanced stage of the HIV/AIDS when the person with HIV has been to receive a treatment. So later the immune system, it gradually become weak, which can lead to the stature of the HIV. So let's talk about the mode of transmission, where a person can transmit the infection from one to another. So the first one is through contaminated blood. For instance, if you have a transfusion of a blood from the infected person to another. Secondly, you can get the infection through a sharp object such as razor blade or syringe. Also, you can get a HIV through having a sexual intercourse with the infected partner through the vaginal secretion or through the semen or through the sperm. So that is why you should know how to prevent yourself. At the end of this video, we are going to talk about it. Also, you can get a HIV through the kissing with the infected person. Normally, in the beginning of this video, I told you that you can't get HIV infection through kissing of an infected person. So you can't get it if the person happens to have a sore or ulcer or lesion in his mouth. So there is no way that you can get an infection by either through kissing the infected person, either through the saliva or anyway, or let the person he has a sore or ulcer or a lesion in his mouth. So there is a lot of various ways that you can contact HIV/AIDS, but these are the commonest ones that we have to know. So now let's talk about HIV/AIDS signs and symptoms. You know, about 13% of the people that are having the HIV/AIDS, they are unaware they are infected. Because some people can have the infection for a month without showing any sign and symptom. So that is why you need to get tested if you have a sexual intercourse with a new partner 3 months back, or if you have a multiple sex partners. So the signs and symptoms of the HIV/AIDS are classified into two. We have early sign and we have the late sign. And the early sign and symptoms of the HIV/AIDS, we have a constant fever and we have a sweating, particularly in the night. We have a larger gland such as lymph nodes and so on. Also, there is presence of the rashes also or lesion in the mouth of the infected person. Also, there is presence of the blister and the vagina or on the penis of the infected person. So now let's talk about the late sign of the HIV/AIDS. So the late sign and symptoms include of the chronic diarrhea for about 1 month, and there is a weight loss for 1 month. But also there is chronic cough longer than 1 month. So now let's talk about the preventive measures of HIV/AIDS. So if you want to protect yourself, or if you want to prevent yourself from getting HIV/AIDS, or if you want to protect someone, here are the 3 ways that you need to do. So the first one is using barrier protection. For instance, if you want to do sexual intercourse and you don't have assurance about the health status of your partner, so you have to use a diaphragm or a condom or dental dam, which can serve as a barrier between you partner that you want to have a sexual intercourse with him. The second one is using safe injection practice. For instance, if you have injected with a needle that was used by you, or if a needle was used by someone else, or either in the barbing salon, or anything that was used by someone, if it is a sharp object such as a razor blade, so there is need for it to be sterilized, or there is need for you to use another one to avoid yourself from getting the infection. The number 3, which is the last on our list of the preventive measures, is to limit exposure with the relevant body fluid. Kindly, to reduce the risk of getting HIV infection, you have to reduce contact with the body fluids such as blood, semen, vaginal secretion, and so on. So if you are a healthcare provider, you have to use a glove or a gown or face mask to avoid a contact with the blood of an infected person. Here we have come to the end of this video. If you found this video educative and helpful, I would like you to support us by subscribing and sharing our videos to your family and friends. See you in the next video. Have a nice time. Bye.